Namaste. Welcome to Mental Health and Wellness with Divya Hari. ADHD or Attention Deficit Hyperactive Disorder is known to be one of the most commonly self-diagnosed disorders because of the commonality of its symptoms. What exactly is ADHD? What are its signs and symptoms? What are the causes of ADHD? And what can parents with children diagnosed with ADHD do? To talk about all this, we have with us today Mrs. Vaishnavi Madharkar. Mrs. Vaishnavi is a trauma integrative therapist and a counseling psychologist who runs her own private practice beyond superficial. Let us welcome her on our show today. Hi Vaishnavi, welcome to our show.
Thank you, Divya. Thank you for having me here.
Thank you. Like I previously mentioned, ADHD has been one of the most commonly self-diagnosed disorders.
Right.
A lot of my adult clients come to me and tell that they have ADHD. Right? So there is a lot of lack of awareness of what ADHD is.
Right.
Could you tell us what ADHD is?
Right. So the full form of ADHD stands for Attention Deficit Hyperactivity Disorder. This is according to the DSM, right? But it is somewhere a misnomer. It doesn't completely include the entirety or the spectrum of symptoms of ADHD. When you say attention deficit, it could be partially true. Attention deficit meaning there is a deficit of the ability to regulate attention and emotions. It is not always deficit. When there is interest, when there is novelty, there is hyper focus, there is too much attention. So it is appropriate to say that it is an issue or a situation wherein attention and emotions are not regulated or titrated according to what fits the situation.
Right. So why do you think a lot of people self-diagnose themselves with ADHD?
Thanks to internet. Thanks to everybody being a therapist on internet. Social media has its own pros and cons, right? Nowadays, everybody is a psychologist. It requires for one person to have minimum qualification of masters to be called as a psychologist, right? Now, every bit and piece of information is consumed by people, by the audience, and they kind of self-diagnose thinking that it is ADHD, which also sheds light on the lack of awareness about what ADHD exactly is. It is also essential to understand that when it comes to mental health issues, it's a broad spectrum. There are many overlapping symptoms, similar symptoms, right? So it is very important to reach out to a thorough professional who can clinically evaluate and then give out a clinical diagnosis. Until then, please do not self-diagnose. If you are self-diagnosing, means that you are already seeing certain signs and symptoms. When you do that, when you see that, when you spot that, it means it is time to reach out to a professional.
Yes. Right. So could you explain what ADHD is in layman terms and break it to the audience?
So Attention Deficit Hyperactivity Disorder, according to DSM, it has got three subtypes. One is the inattentive type dominant, one is the hyperactivity type dominant, one is the combination type. When it is inattentive dominant, there is problems with attention, sustained focus, forgetfulness, and the short-term memory is kind of difficult to retain. That is inattentive type. And hyperactivity type, it is a lot of energy, it is a lot of multitasking, and difficult to harness the energy kind of a situation. The combination type is a combination of both, wherein a person experiences issues with attention, focus, as well as too much energy. So this is just a superficial explanation, but going deeper, attention deficit hyperactivity disorder is also an issue wherein people experience difficulty with reckless behavior, risk-taking, time-blindedness. They cannot gauge. They either overestimate or underestimate how much time a task might take. They might take too long to get ready. They might not get ready until the last moment, right? So that is called time blindedness. And there is difficulty with regulation of emotions. They are deep, passionate lovers. At the same time, when it goes the other way, it is another end of the spectrum, right? So that is with hyperactivity. Then it also is about difficulty prioritizing, difficulty in sequencing, like what comes after the other, getting too overwhelmed with a lot of paperwork. They don't know how to prioritize the papers, and it is an issue about procrastination. There is a starting point problem. Your mind tends to push away tasks that require a lot of mental energy or mental investment. So procrastination. And it is also difficulty with day-to-day life activities, executive dysfunction as we call it, right? So they might just keep forgetting things, forgetting little things. So all these put together becomes a broad spectrum of ADHD.
You beautifully explained the signs and symptoms one can look out for, right, for ADHD.
Yeah.
A lot of people also say that ADHD is a childhood disorder or an adolescent disorder and can't show up in adulthood or can't have a late onset. Is there any particular age group that ADHD is limited to?
All right, firstly, once somebody is diagnosed with ADHD, it is more like diabetes, physically, if I have to compare. So it doesn't actually go away or fade away in adulthood. What could possibly happen is that people might learn to mask it because of the societal conditioning and the gender roles. They might learn to mask, but it is still very difficult to deal with day-to-day activities. Having said that, symptoms start showing before the age of 12. It could start anywhere from 3 to 4 years. The symptoms can be seen from 3 to 4 years of age. So once that has started, then it has started.
Mm-hmm. Yeah. So can it start during adulthood too?
Well, no. That is the main point that we look into. Right? Did you have any issues in childhood?
Yes.
Generally, it starts showing up. It becomes full-fledged at the age of 19.5, but the symptoms will be present in childhood. It could have been masked, or as students, they might have been judged. They might have been, not all, but some could be poor in academics. It is also difficult to note or spot the signs because some are extremely intelligent. People have this perception that if you have ADHD, you will be bad at math. It's got nothing to do with IQ, right? So it has got to do with attention and focus, regulation of it. So it could have been masked. It becomes full-fledged in adulthood. Then you get into relationships. Then you get into life. Life happens. That is when, it starts showing up, when certain responsibilities and certain kind of responses are expected out of you.
You beautifully highlighted the importance of not neglecting your symptoms when they show up early on, right? I think there is a lot of shame associated with these symptoms when they show up in childhood because of the fear of being bullied by your peers, because of being ostracized by the society. So this also highlights the importance of not neglecting symptoms when they come out and actually seeking for help when they show up itself, right?
Yes.
Are there any particular causes for ADHD?
Okay. A singular cause has not been pinpointed as yet for ADHD. It definitely has a strong genetic predisposition, like other mental health issues as well. So, major chances of somebody having ADHD, they might have a parent with ADHD, which might not have been diagnosed. So, that has been one of the major causes that has been pinpointed. Apart from that, exposure to toxins, right? Either it could be factory toxins, or even alcohol, smoking while the pregnancy, or if there are too much toxins that the child has been exposed to. That has been pinpointed as one of the causes, but a singular cause has not been pinpointed as yet.
Okay, so I think it also gets hard for parents or caregivers to take care of children, right? So there is something called caregiver burnout, where parents or caregivers of children with a diagnosis experience immense amount of stress. Are there few tips you can give parents with children who have been diagnosed with ADHD?
Sure. So, just a trivia that ADHD comes under neurodivergence, right? In DSM, it comes under autistic spectrum disorders. So there's autism, and then there is ADHD, and then there could be a mix of both. Such people are called neurodivergent, which is not equal to abnormal.
Yes.
Which is very important to understand. They have a different way of functioning in life, and there are strategies that can be taught to deal with certain difficulties or executive dysfunction. The problem arises wherein parents try to drag them and change them and convert them into neurotypicals, right? Everybody has got quirks. Nobody is perfect. We all have different ways of functioning. What is important is to realize that it is not abnormal, but it is not neurotypical as well. So you need to understand that they can have their own way of functioning, without making them feel like they are inadequate in something or they are inferior to somebody. So parents overburden themselves a lot in terms of trying to drag the child to fit into the society. Who sets the standards anyway?
Yes.
Is my question, right? So if the parents are psychoeducated, then it becomes easier for them to deal with the child and stand up for the child. It is, in my personal opinion, the best way to destigmatize. When parents are psychoeducated. So parents need to be psychoeducated regarding what symptoms to look for. When the child is being hyperactive, when the child has got too many issues with behavior or conduct, if the child is becoming aggressive, violent, and if the child has got difficulty recovering from a low phase, from an emotional outburst, if there are frequent emotional burnouts, if the child is taking too long to do the normal chores like brushing the teeth, like watching TV, if there is procrastination, all these symptoms are judged and misunderstood by the society and parents. The parent is trying to discipline the child and put the child into the routine, but on the contrary, routine, mundane tasks are extremely boring for people with ADHD. It gets difficult. They need a routine, but they have this novelty-seeking trait that makes routine boring, and it becomes difficult for them to stick to a routine.
Yes.
These are the areas wherein it becomes challenging because of the nuances of ADHD. So if parents spot these signs, please reach out to a mental health professional who could psychoeducate you better, tell you if at all your child has got ADHD or not. So yeah, that's when I think parents can work on their own stress. Also, it is important to note that the child is kind of catching the vibe, right? It is important for parents to be regulated around the child.
The child can read the room.
Exactly. So it is easier said than done, but if the strategies are learnt, it somewhere becomes easy to not blame the child. So yeah.
You beautifully mentioned about psychoeducating parents, right? So family therapy comes into picture there. Going to therapy as a family, going to therapy together. Apart from family therapy, are there any other ways to deal with this?
So apart from family therapy, there is something called as play therapy. Sensory sensitivity is a trait wherein people with ADHD, they have heightened sensitivity with regards to senses. There are a lot of sensory awareness games, sensory gratifying games, and energy channelizing games. So these are the strategies that parents can put to use when they want to help child become accommodating, right? And as well as do certain tasks with the child. When the child completes a task, reward the competence. Reward is very, very important. It is important to realize that dopamine deficiency is one of the major factors in attention deficit hyperactivity disorder. So it is important to understand how to hit that dopamine. Reward, or the anticipation of reward is what hits the dopamine. More than the reward in itself, it's the anticipation of the reward that hits the dopamine. So these are ways, if parents can learn to do this, if they can be psychoeducated, then yeah. And also, I think every parent, just like the child is born and they go to a doctor to get a general blood test done, every parent after a child is born, after a certain age, they can reach out to a mental health professional for a general checkup. Or if they spot signs, they can reach out to a mental health professional and ask, how can I deal with this better? What is happening with the child? They can become an ally with the child so that it becomes easy for the child as an adult in the future.
That really highlighted the importance of parents or caregivers supporting children, right?
Yeah.
A lot of people also say that I'm very fidgety, I have ADHD. So they use ADHD as an adjective to describe their behavior. What do you have to say about that?
Fidgeting, restlessness, like I said, there are many overlapping symptoms. It could be anxiety, it could be ADHD. ADHD also comes with a lot of other comorbidities like OCD, bipolar, right? Personality disorders,
Yes.
right? Borderline personality disorder. So, of course, yeah, these are terms. I don't know if it is even appropriate to label them, but just for psychoeducation's sake, right? So it is important to pinpoint what exactly the issue is, what the clinical underpinning is. Every behavior seeks a need. There is a need underneath every behavior. So if the need is met, then it becomes easier for the behavior to be rectified or modified.
That is where seeking help and going to therapy and getting psychoeducated about your behaviors itself come into picture, right?
Right, absolutely.
Before we wrap up, can you give us the mental health tip of the day?
Since we are talking about ADHD, I would like to say that a lot of quirks or traits that are usually judged and misunderstood by the society, which are stigmatized by the society, could have a clinical underpinning. Could be ADHD or could be something else. Whether it is hypersexuality, people sometimes tend to have multiple relationships, the novelty-seeking behavior, right? So instead of judging somebody or somebody's character right away, straight out, try to understand what the situation is. Reach out to mental health professionals if you find your child or a teenager or an adult who is your child. If you see certain traits, reach out. Don't become a Google master. Don't rely on the Google University. Nothing good comes out of Google University. Please reach out to a resource that is reliable, a valid, authentic professional that can give you a clear-cut picture about what the situation is.
Thank you so much for psychoeducating us about ADHD, and thank you so much for the tip you mentioned about not relying on Google.
Yeah.
Thank you.
Thank you so much, Divya, for having me here. It has been utmost pleasure trying to spread psychoeducation through your medium. Thank you so much.
Thank you. I hope you have an awareness of what ADHD is. I will be back with another episode. Until then, take care, stay safe.
Click on the bell icon to watch our latest videos.